Good evening, class. So today's topic for discussion will be. Today's topic for discussion will be communication that will specifically be designated towards the sector of healthcare. Till now, we have discussed the communication which is relevant to the communication in general. But our today's topic will be specifically talking about the communication and its importance in the healthcare sector. Okay, communication in healthcare. The poor communication has been the factor of 1,744 patient deaths, over $1.7 billion in malpractice costs nationally in past 5 years, according to the study published in Peers Healthcare. So there is a journal called Peers Healthcare which has carried out a study according to which communication, or particularly the lack of communication, has become a very very dominant factor in patient deaths when it comes to the working of healthcare. Okay? 1/3 of the deaths are because of the lack of communication between healthcare personnel, where which at the end of the day affects patient safety. This shows that better communication methods would benefit both patients and healthcare providers. Effective communication both intra-hospital and inter-hospital. So these are two types of communication that work within the healthcare sector. Intra-hospital and inter-hospital is important for healthcare providers to protect their patients, save on the cost. So it is not only necessary to save the lives of the patients, but the other things that are important factors which are affected of the poor communication within the healthcare sector are: first, patient safety; second is saving of the costs and increased day-to-day operating efficiency. So these three things are the important factors in healthcare sector which are affected by the lack of communication skills between healthcare personnel. Meanwhile, patients benefit from increased access to their medical histories, which reduces chances of medical errors. The importance of the emphasis of communication skills in healthcare sector is the focus on patient safety. When considering the importance of communication in healthcare, patient safety is one of the top reasons to create an effective communication structure in any healthcare organization. Inadequate communication is often leading cause of in-hospital deaths. This is what I have already told you. This is what is an output of a research carried out by Peers journal that we have studied just now, that the focus on patient safety is the only reason to increase communication efficiency of the healthcare personnel. In a retrospective review of 14,000 in-hospital deaths, communication errors were found to be the leading cause, twice as frequent as errors due to inadequate clinical skills. This has been studied by various doctors who work in various reputed hospitals. They say that 2/3 of the deaths are the reason of inadequate communication skill rather than the inadequate clinical skills. So जो doctors हैं उनकी inadequate clinical skills से deaths नहीं हो रही है, बल्कि किससे हो रही है? Inadequate communication skills. Because when you work in a hospital or any setup which is more or less similar to a hospital like nursing home, clinics, or any other healthcare setup, there you need to interact with various people. First is your patient. Until unless your patient is unable to communicate to you something, or you are able to communicate something to your patient, the communication gap will be reduced. Apart from that, you also have to communicate with the other staff that works in the hospital, right? Because it is not only doctor who is responsible for the entire patient care. There are many other personnel who are liable to various things that have to be performed by the patient or even the doctors also. So adequate communication is an important factor by this aspect if we consider this, and it is said in various reviews, and it has been studied in the various reviews, that lack of clinical skill has turned out to be one of the important aspects of the deaths among the patients. While communication errors can have severe consequences, these issues are often relatively easy to fix, right? Communication errors are easy to fix. meaning many patient deaths caused by communication errors are preventable. That fact alone is one of the important reasons why communication skill is so important for the patient safety. There are two types of communication that works within healthcare sector. First is intra-hospital and second is inter-hospital. All of you would aware of the terms intra and inter. What are their meaning? Intra means within the hospital and inter means between two hospitals. So inter-hospital communication involves information sharing among multiple sites or institutions. That includes, inter-hospital means outside your hospital, between two hospitals. So inter-hospital communication involves information sharing among multiple sites or institutions. That includes transmissions between facilities owned by same organization and between completely separate healthcare entities, moving patients from one facility to another, sending medical records and transporting vital medical equipment all require clear communication between the sites, right? So when you want to, two hospitals work together or two hospitals of the same organization work together, you have to have a clear communication between them. If you don't have the clear communication, the information won't be, betterly grabbed by the institutions which are having that kind of communication, and it would lead to first the expense of unnecessary cost, the other could be the death of the patient. Next is intra-hospital. So communication doesn't only work with when you communicate with two separate entities. Problems with communication also occur among problems when communication also occur among personnel within the same hospital. Intra-hospital communication is any information sharing within the singular institution, whether it involves coordinating room changes, scheduling surgeries, assigning further tests, or even setting up the appointments. When doctors, staff and patients are not effectively sharing information, the efficiency of each process may decrease, potentially resulting into unnecessary costs or even danger to the patients. Patient record delays, lack of procedural coordination and even serious medical errors may all be the consequences of poor intra-hospital communication. I hope all of you would understand what intra-hospital communication is. When you schedule surgeries within a hospital, when you shift patients to from one room to another room, when you set up the appointments for the doctors, or even when you coordinate with doctors, with staff, or even with the patient and their relatives. Okay, one of the important aspects that involves the communication in healthcare is transmitting patients' data. Patient records are shared securely via inter- and intra-hospital communication. Delays in receiving records can cost hospitals millions of dollars each year in unnecessary expenses. Patient data are used to create a thorough medical history and provide appropriate medical care. When patient data aren't shared between departments or other healthcare organizations, there may be much higher chance of practice errors and subsequently increased costs within the hospital. That is why clear communication between transmitting patient data in terms of what is the data and in terms of how it is being communicated, both are very, very important. Next is collaborating with your colleagues. So intra-hospital communication relies heavily upon collaboration between colleagues, patients, lab technicians, doctors and staff. All need to be in constant communication to create a system that operates as smoothly as possible. Inter-colleague collaboration also includes entering information accurately into databases, especially shared ones. Inaccurate communication between the departments can lead to the errors in the database entry, which in turn can potentially risk patient safety. Alright, we will have the attendance towards the end of the session. There are around 2-3 more slides and then we will stop. Next is hospital leadership. So whether publicly or privately funded hospitals, they need to operate as such. Hospital managers and other leaders must communicate frequently with doctors and staff. All hospital leaders and managers not only oversee administrative staff and tasks, but also can play a vital role in individual patient healthcare plans. To be effective, they should maintain open lines of communication with those around them and also facilitate information sharing between hospitals, departments, and with other institutions. So, I mean, you need to take care that where communication plays a very, very important role in terms of patient safety and cutting of costs. First is transmission of data, next is collaboration with the colleagues, and the last is hospital leadership. Hospital leadership would be at the end of the person you are employed under, right? The next is telemedicine advancement, which is not my topic to be discussed. I mean, you are also having the other classes for telemedicine communication in the foundation course itself, which I don't know if been carried out or not, but I hope so. So, telemedicine advancements are the advancements that have, you know, very important role of communication to come in. How? Because it is communication through various, you know, various interfaces like internet, like online channels, video conferencing, or so on and so forth. Next is the barriers of communication when it comes to healthcare sector. At the patient provider level, patients may not feel comfortable disclosing the sensitive information such as substance of misuse or sexual dysfunction or to their care providers, I mean to their doctor. Patients withhold medical information for many reasons. I mean, what could be the reasons of that barrier? They feel intimidated by the provider, so you have to make sure that the person you are dealing with should not be, you know, fearful towards your behavior. You should be behaving in such a way that the person is not intimidated by your behavior. The next is they believe that the provider won't listen to them. So, I mean, I personally have come across many doctors who just keep on writing on their notepad and they don't even listen to the patient. So, this is what, I mean, these are the small efforts that you can do towards your patient so that the person feel, I mean, your patient feel comfortable while communicating your problem to you. So, now why people don't communicate? First, they feel intimidated, they feel fearful about the doctor. Next is, they believe that the doctor won't listen to them. They feel disrespected by the request to disclose. Next, they question medical advice in general. I mean, you might have come across various instances where your parents say, अरे उसको क्या मालूम, ऐसे थोड़ी होता है, हम तो ऐसे ही करते आ रहे हैं, है ना, बचपन से. इसलिए हमें क्या लगता है कि जो मेडिकल एडवाइस है हम जनरली उसको ही क्वेश्चन करते हैं. तो आई मीन हाउ कैन यू अवॉइड इट? यू नीड टू मेक योर पेशेंट ट्रस्ट you, है ना. You should be able to inbuild that faith in your patient about you, so the person is, a person tends to obey what you say. They struggle with physical or psychological trauma. That could also be one of the reasons where the patients, they don't disclose their information to their healthcare providers. These are the barriers that generally come across when you say when you deal with your patients. So this is up to you and up to your behavior to overcome these barriers so that the patient reveals, I mean, his problem or whatever problem he has, his trauma, mental, physical, or any kind of other trauma, to the healthcare provider. Next is linguistic barriers. If you are working at such an area where the linguistic aspect or the linguistic background is not same, there could be also the communication barriers that would arise. How can you avoid those barriers? By having interpreters or language translators. Next would be mismanaged healthcare files, which would be done at the end of the at the end of the doctor as well as the administrative staff. Next is strategies of effective communication, which we will discuss in the next class.